All right. Dr. Tamara McClintock Greenberg is a clinical psychologist in San Francisco, where she has been in private practice since 1999. Tamara specializes in seeing people who have medical issues and loved ones impacted by illness. She also sees people with depression, anxiety, as well as PTSD and complex PTSD. She has written 6 books and numerous chapters. Her most recent book is the Complex PTSD Coping Skills Workbook, an evidence-based approach to manage fear and anger, build confidence, and reclaim your identity, which has been translated into 5 languages and was released as an audiobook in June. And I have a copy of, if everyone can see this, When Someone You Love Has a Chronic Illness by Dr. Greenberg. And I'm almost finished. It's just a wonderful book. Thank you so much, Dr. Greenberg, for being with me today.
Thank you for having me.
So I was really curious, like, this is such a great read, and it's really appropriate for everybody. It's a read that anybody I think can benefit from. And I love your checklist at the end of each chapter with what people can do: practical, pragmatic. And I was wondering, Dr. Greenberg, what made you want to devote some of your practice to things such as chronic illnesses or complex PTSD?
Well, I mean, the chronic illness came before thinking a lot about complex PTSD. I specialized in health psychology in graduate school because I figured there was always going to be a need for people who could think about illness and who could think about aging, both of those things together. And of course, as we age, we're more likely to become ill. Um, and and I think historically in our field, um, not even just historically, I see it now a lot too, that people's physical problems can frequently be pathologized, especially for women. And women are frequently told that their symptoms, if they are not easily explainable, that they are all in their head. And so I think one of the reasons I was drawn to working with medically ill people is because one, I really did think there was a need. And two, I think, although I don't know if I would have articulated it at the time, that was 30 years ago, but almost kind of from a feminist perspective, like to sort of help women, find a voice in medicine, but not just women. I mean, it's hard for everybody in medicine. It's really hard to be a patient. I think in many places, but certainly in the United States, it's very difficult to be a medical patient. And so, the other sort of part of working with medical patients has been to be an advocate, for people who are sick and struggling to get the help that they need. So it was a lot of different things, but those are kind of the top things.
Well, this book breaks so much down. Like, I can't think of a person that this book would not benefit. Like, there's nobody that would not get benefit out of this. And I especially love the part, Dr. Greenberg, where you take the time to break down the culture of medicine. Because
Yeah.
I'm in Canada. I don't know if it's the same in the States, but it sounds very similar when I'm reading through it. And that's probably the biggest gripe or even legitimate complaint, like that I just hear floating around all the time, is just um you know I'm never heard, I'm dismissed. And it's almost like there's half of it is like, that's true, but also another part of it is not understanding maybe the culture of medicine itself. And I think that there was a lot of value in that, and I took a lot away from that, and was sort of more understanding maybe towards my healthcare professional a little bit, seeing where they're coming from as well. So I mean, that, like, do you find that a lot of people talk to you about that and get a huge benefit out of that part of your work?
I mean, I think it's helpful when people sort of get to hear what clinicians are going through, because
Mhm.
I mean it's hard because sometimes people can feel like I'm being defensive on behalf of clinicians, on physicians, but
Right.
but it really is complicated. It has changed for them. Things are so much harder, and as technology has increased, the role of a human person in medicine, the doctor-patient relationship, has decreased. And so I think, and of course, there's so many stressors on physicians related to electronic medical records and, big corporations buying up practices. And I mean, there's just so many things, but they are under a lot of stress, and I think that it is helpful to not take it personally. To your point, I mean, that's exactly why I wrote about it that way, because I think it's easy to feel, certainly when I go to the doctor, I feel like, oh, like I have like a transference reaction, like I want my doctor to be like my mom or my dad, and to take good care of me and to make me feel loved. And it's like, no, I'm not going to get that here.
Yeah.
And it's not about me, right? It's just about the system, and they just don't have time.
Yeah, I think, and just realizing that and being educated, that I think is a huge, takes a piece away of that frustration, at least for me. So thank you for dedicating a part of your book to that, Dr. Greenberg. And if you don't mind, if we could just go a little bit into your work on complex PTSD. First of all, maybe a little definition as to what that is and what you do in that field.
So yeah, so primary PTSD is what most people think of when they think of PTSD, and that is having, one or two very traumatic events, typically in adulthood, and it causes severe suffering, nightmares, flashbacks, psychic numbing, feeling detached from others. Complex PTSD is a very different diagnosis, although there's some overlap, but basically complex PTSD are the symptoms of PTSD that I just listed, but also things that are woven into identity and personality. So not having a clear sense of who they are, having had been abused or had difficult experiences, usually starting in childhood. And so one way I describe it is complex PTSD is the aggregate of a difficult life. And that doesn't mean that folks can't be resilient, who have complex PTSD. They can be incredibly resilient, incredibly high functioning, have great jobs, but there's a sort of undercurrent of suffering related to, I think it's a sense of not knowing really who they are, but also a feeling that if they spend too much time in their own mind, they can get very overwhelmed by thinking about things that are painful. And so they tend to avoid feelings, and they outsource. I call it outsourcing, like they outsource the contents of their minds into others. So they're very good at figuring out what people want from them. This is like it's the cognitive consequence of hypervigilance, if you will. If you're hypervigilant, you're paying attention to what's going on the outside, very little attention to what's going on the inside. And so when you're paying so much attention to the outside, you get very good at being sensitive to other people's needs. You can be a great therapist, a great doctor, a great lawyer, a great police officer. However, people with complex PTSD can really get into trouble when they have to focus on their own needs. And so that's one, I think, of the more serious consequences, is a general sense of not knowing what they need. And then there's also other symptoms related to, difficulties modulating emotions, difficulties in relationships, severe negative self-concept, substance abuse, sometimes of physical problems, and suicidal thinking.
Thank you so much, Dr. Greenberg, for clarifying that. I don't want to get too much into this or take too much of your time on this. It's just I'm a little confused about this, and I hear different perspectives on this, and perhaps you could give me yours. Is there similarities to borderline personality disorder? Or is there often a misdiagnosis as borderline personality disorder? They seem similar but different. Can you go a little bit in on that, if you don't
Yeah,
mind?
it's such a good question.
Thank you.
Yeah, no, it's a really good question. A lot of people in my field use the term complex PTSD as a euphemism for borderline personality disorder. Um, I have, I'll tell you kind of like my two issues with that, and then I'll tell you what some other experts are saying about it.
Please.
Um, my issue with that is first of all, I think that our field has a problem with personality disorder diagnoses. From the beginning of the DSM, our psychiatric Bible, I'm just going to quote a statistic and then I'll explain what it means. The inter-rater reliability coefficient of personality disorders in the DSM has always hovered around 0.30. And what that means is 30% of clinicians are actually going to agree on what kind of, and I compare it like, huh, if a physical illness that only 30% of doctors could agree that I had, how confident would I be in that diagnosis? So that's, I think, a concern I have about how we use a diagnosis that has such little reliability in terms of statistically, thinking about using that with patients. The second thing, though, is I do think that borderline personality disorder has been extremely pathologized. It's been over diagnosed in women. We never talk about men who have those symptoms, but I know a lot of men who do. But we never think of men as having those symptoms. And I think also there's such a stigma attached to having borderline personality disorder that, in my opinion, it's just not helpful. And so what I like about complex PTSD is that, one, it's a more compassionate way of looking at some of the issues that you see, in folks who might be considered to have some borderline personality traits. That being said, there's a couple of researchers and clinicians, Julian Ford and Christine Courtois, and they've been writing about complex PTSD for a long time. And one of the things that they're looking at right now is, and their hypothesis is that there are likely distinctions between borderline personality disorder and complex PTSD. One of the things that they talked about in a recent article was that people with borderline personality disorder, they tend to fear abandonment, whereas people with complex PTSD are more terrified of closeness. So that's one example of what the research seems to suggest. But anyway, that's a very long answer to your question, and I don't mean to get too much into the
No.
weeds. But that's my thinking, and these researchers, Ford and Courtois, they're ones to watch in terms of, I think they're going to figure this out.
I'll do that. Thank you. And yeah, thank you so much. And I also won't spend too much time on this, but it's very fascinating to me. It's a little bit confusing to me because I've listened to people, and I'm sorry, I can't think off the top of my head who they are, but who seem to, like you said, think that it's two separate things. And also that maybe some of the females who've been diagnosed with borderline may have complex PTSD, but other females who've been diagnosed with borderline personality may have narcissistic or antisocial personality. And that's where there's sort of a lot of confusion and sort of a big problem, I think. But sort of, moving on from that, Dr. Greenberg, what can I ask, what made you want to write on these subjects to share them with people? Were you getting a lot of requests to speak about these issues one-on-one? What sort of made you want to write about them in books?
Well, I do like writing, but the biggest thing that drove me to write, honestly, is I'm from rural Minnesota. And I grew up, in a very plain spoken culture, where people just kind of say what's on their minds. And when I went to graduate school for psychology, I found that I didn't really understand a lot of what I was reading, or that I thought that things were unnecessarily complicated, particularly in psychoanalytic writing. I thought that papers, were just way more complicated than they needed to be. And so I, in my own head, had to translate a lot of what I learned into language that made sense to me, and that was more plain spoken. And so one of the things about my writing is I really have tried to translate a lot of complicated ideas into language that makes sense to everybody. I don't I don't think there's any reason we need to alienate people by just not speaking in a plain way about these things. It's not rocket science, you know what I mean? Like it's
Yeah.
just, and even if it was, we could still make it more plain spoken for people, you know?
Yeah, your books are amazingly palatable and just wonderful read for. There's, like I said, I don't think there's anyone that would not benefit at least from this book. And um, with complex PTSD, that work you said came after your work with chronic illness.
Yeah, because I mean there's so much trauma and having severe illness. And so it just got me thinking, it got me thinking more about trauma in general. And then I just ended up started seeing more younger people in my practice, you know, around the same time, you know, maybe 10 years ago or so. I started seeing more young people in my practice who had, you know, that on the outside, it looked like everything was okay for them growing up, but it was very clear that there was a lot of neglect, parents intensely missing basic needs, basic emotional needs. And I really felt for these young people, and I thought I wanted to better understand what they were going through. What, you know, one of the things about trauma, this is not my original idea. This is Judith Herman's idea. Judith Herman, of course, being the person who developed the term complex PTSD.
Mhm.
She's the one who developed the term. You know, one of the things that she says, which I just think is so brilliant, is people who have traumatic histories, they frequently don't see them as being related to their current problems. So people will come into therapy with this sense of there's something wrong with me, I'm not right. But you know, and then if you try to think about their childhood with them, they'll say, oh yeah, such and such happened, you know, something horrible, right? Such and such happened, but that's not related, you know, to what I'm going through.
Yeah.
Um, and so I think there is this intense way that people with difficult adverse backgrounds, they blame themselves for their suffering. And they think, they kind of going back to this idea of complex PTSD and severe negative self-concept, they they feel like they're the ones who have damaged their lives, and that they are solely responsible for where they are. And I'm not saying, you know, people shouldn't take responsibility for their lives. That's not what I mean. But what I mean is people can feel like they're damaged and toxic, as opposed to realizing they didn't get this way on their own.
Right. Right. And do you, a question that comes up for me a lot is complex PTSD highly treatable? I mean, is there a lot of hope to get to a better place for people who are dealing with it?
I mean, I think so. I mean, look, there's there's a bunch of different ways people are treating this. There's, you know, the complex PTSD isn't even in the DSM. It is, right? And so people are doing a lot of different things. You know, it's a longer conversation, but you know, I could go through all the different treatments. But basically, I do think it's treatable. I think it's treatable if people use a number of different methods and techniques. I think that it's treatable if we get a buy-in from clients. And that means that at some point, they may have to think a little bit about what's happened to them. It doesn't have to be a lot. You know, we don't have to go back and unearth everything. But they do have to kind of come to terms with the fact that, again, that this is not all their fault, that they have things that have happened to them that have gotten to them to this point. And I think they have to be willing to try to tolerate and manage difficult emotions. You know, I mean, I think the thing that makes me the most sad sometimes in my work is I'll work with somebody, you know, people really likable, really talented, really resilient, and yet they're miserable. And being in therapy does tolerate dealing with difficult feelings. And so if you can't get past that, if you can't figure out how to learn how to sit with anxiety, grief, sadness, anger, anger is really scary for all of us. It's really hard to tolerate. If people aren't willing to try to learn how to manage those emotions, then I think it's much harder to treat. But I do think we need more clinicians who are compassionate and who use a number of different techniques. Where I live in California, many people, not all, but many people will learn one or two techniques, like just for example, EMDR or a somatic therapy or prolonged exposure. Those are just a few. And then they'll use that on everybody who comes in. But I'm an older psychologist. I was trained in the early 90s, and how I was trained was, we learn all the different ways to help people. And then we meet a client and then we apply what we know in a very tailored way to what the client needs. And that is going to involve possibly a lot of different ways of working. I think with complex PTSD, because of, and I haven't mentioned it yet, but because of dissociation, it really does require us to pivot our approaches pretty quickly at times, from session to session and sometimes within sessions. And so I think the toolbox has to be really, really big. And you have to be ready to use a lot of different ways to help people that is tailored to what they want, not what I think is best, or because I learned this one thing that's going to work for everybody. That isn't how it works.
So is it fair to say there are no quick fixes with complex
Very,
PTSD?
very fair to say there's no quick fixes.
Right,
Yeah.
right. Okay. There's no quick fixes, but there's hope. Okay, so do you still plan in the future, Dr. Greenberg, to be working with people who have PTSD or putting out books and literature on CPTSD?
Yeah, I don't know what I'm going to write next. I'm a bit, you may have heard things are kind of challenging right now in the United States politically.
Yes, yeah.
So I have to make it through November before I
Right.
can do
Sure,
after that.
sure.
I'll have some space. But yes, I continue to work with these patients though. They're great. I really
Wonderful.
love working with these a lot. Yeah.
That's fantastic. And if somebody is watching this who thinks that they might be dealing with this, I know, like, not to go into a huge discussion, but just for Band-Aid, is there, should they talk to their doctor? What kind of things should they do to get the process started to maybe start feeling a bit better or finding out what's going on?
Yeah, I mean, I think for something complicated like complex PTSD, a lot of doctors, medical doctors, aren't really gonna necessarily, they're, as we said before, when we started today, they're busy,
Yeah.
Of course, in America, the guidelines are that doctors should be screening for depression and anxiety, but physicians are like, are you kidding me? Like, how do I have time? I can barely do the body stuff. So I think if somebody's curious, they should meet with a therapist, even if it's just once, to kind of explain their symptoms and see if they can get an idea from a therapist, like what might be going on. I think that's one option. I think another option is there's a lot of really good reading and books and stuff on the internet about it. I think that I think people have to be careful about their sources, but you can absolutely find any number of complex PTSD checklists, on the internet. A lot of people are writing about it right now. And so there's a lot of really great literature out there. Ariel Schwartz has written a workbook that people love. And there's others. I just think of her because her name comes up a lot and people really love her writing and her work. So
Absolutely. I've heard good things about her work as well. And I'm going to be getting a copy of yours as well. There's a few other people. I think Pete Walker
yeah.
wrote a book that I read that I got some good things out of. There's a few people talking about it. A lady there's actually a psychotherapist on YouTube, and I'm not sure what all she does, but I think her name's Dr. Snipes or something like that. And she actually goes into complex PTSD a fair amount. So it's kind of nice to see that the subject, like you said, be wary of your sources, but that it is being talked about. Dr. Greenberg, where can people follow you? Do you put workout? have like an Instagram or somewhere that people can follow your work?
I'm on at Twitter or X. I'm on there, and I post on there. I post some stuff about my work, but I also post a lot of like just health and medical related stuff. I mean, kind of just to help disseminate good writing and research, like things that are helpful to all of us as patients. I post that kind of stuff on Twitter, and I am on Instagram. Um, in part, posting stuff on my work, and then in part posting pictures of my dogs.
Wonderful. That's great. There's a lot of people love that, I'm sure.
Well, I don't know. I mean, my favorite part about social media are the animals. So, and I have two pugs that I do love posting pictures of. So,
Oh, pugs are so cute. Pugs, I don't have
yeah,
dogs myself, but oh my gosh, pugs are so cute.
they
Um,
are like little aliens.
yeah, they're just adorable, just adorable. Dr. Greenberg, thank you so much. Thank you so much for taking the time today to speak with me. And I hope everybody gets a copy of this book. Like I said a few times, there's nobody that will not benefit from it. I look forward to also getting a copy of your book on CPTSD. I think all the literature out there that, it's just wonderful that this knowledge is coming out there. And thank you so much for the work that you've been contributing towards it. Thank you.
Oh, thank you for having me. I appreciate it.
Yeah, it was lovely to speak with you.